All right, everybody. Good morning. It's Dr. Pearlman. And we got some time this morning because I actually got in much earlier than usual. Today is one of those days where I actually woke up very early, felt well rested, did the right things, got ahead of my schedule in terms of notes and administrative work, was able to get Dr. Axel settled in despite some of the damp weather, and now we're ready to serve. So I thought about it. I said, what can I make a video about? I said I could do a video about, why chiropractic works, which I kind of talk about all the time. Hint, it works because of neurologic stimulation to the actual brain, to your frontal cortex, the way it works on your cerebellum, the way it works on our neurology that translates from brain down to spinal cord through the spinal nerve root and or the spinal level we impact in particular. Once you actually get past the cord to the lower back, you're dealing with something that's discogenic, which could be more specific to like pain cases. And certainly that is a whole other topic, just like I'm kind of doing right now. But I want to establish, because a lot of people will find some reason to say why it doesn't work or how cracking something is just releasing gas in the knuckles, whatever, ridiculous example. And that's all it is to treat the symptoms. And newsflash, treating symptoms is absolutely what that is doing, because if people want to say they're fixing the underlying cause, and this is not taking a jab at anybody, but if you actually say something like that, what you have to understand is, unless it's a slam dunk, obvious limitation of matter, certain piece of bone or disc or whatever arthritis is like sitting on a nerve or sitting on your spinal column, and then that gets taken out, there's nothing that's really addressing the problem, because it's all encompassing. There's multiple factors that make us sore, hurt, inflamed, have pain in different sites, have exacerbated symptoms that make us flare up from more of a chronic condition, which leads me to my point, the actual point I want to make today, and I'm going to make this quick. If you are suffering from something or you're not feeling adequate all the time, and then you go and you start doing your research, or you're listening to these health podcasts and these gurus, and they're saying like, cut out gluten, cut out coffee, switch to tea, cut out dairy. Clearly carbohydrates are the evil devil. High fructose corn syrup. There are so many things. You have to do what's called the common sense diet, or start implementing common sense in your life. And that's kind of, I don't want to like make it sound almost like a little too insensitive when I'm saying it's common sense, but like common sense would be, if you got hurt at the gym and you felt your back go pop, you've got to come to the chiropractor. And the people that know me would go to Dr. Pearlman. Okay, I'm more than happy to help you when you're at your worst in terms of pain. I'll probably be at my best in terms of clinical practice. If you are consuming coffee with fake sugar and fake fillers and all these things that have carrageenan, if I'm even saying that right, high fructose corn syrup, and alcohol, sugar additives for sweetness, things that are going into your body every day to like accompany just iced coffee, then if you're not feeling good, or you're getting GI distress, you're getting stressed out, or you're not sleeping good, or whatever, right? You got to cut that out. If you are eating cookies every day after you eat a perceived healthy meal, but then you're having a dessert too, and you're just like, well, I'm eating a healthy salad, I'm not really doing anything I shouldn't, but not fact checking yourself as to consuming that dessert every day that also has flour, corn, wheat, sugar, any other additives or vegetable oils, is the one I wanted to say, that are like really bad for you, especially in combinations that will make you insulin resistant at the worst possible times, which then leads to pre-diabetes, high blood pressure, and then eventually, diabetes, cardiovascular disease. You've got to be able to fact check yourself, take accountability, and just use common sense and start to wean off the things. If you feel like you're always getting sick, and you have a chance to then maybe research something for like immunity. There are immunity products out there, such as just vitamin D, vitamin C, B12, B vitamin complexes that might go a long way by you starting to take that in. Or if you start to eat a little bit more fruit in your diet, like strawberries, pomegranates, the oranges and things like that, even just squeezing lemon into your water, or even having just some lemon on the tip of the tongue and through the gums as a disinfectant. Start taking better care of your oral health, hygiene, things like that. All of these processes, by doing the right thing on these health guru like podcasts, are going to be the thing that make you feel better. And you've got to start doing it now, or you're going to have this vicious cycle of woe is me, I'm doing everything right, looking around the room, no, you're not. And how can I optimize my health? Especially as we age, our tissues and our cells become much less resilient. That's why we're not able to recover. And we say, oh, I'm getting old sucks. Yes, because you can't recover. It's not because you're just getting old, it's because you can't recover. So how can you enhance your recovery? Because can't is such a strong word, but it's through chiropractic, supplementation, eating a very clean diet, making sacrifices in terms of treats and sweets, things of that nature. So again, I've carried on too long. I wanted to touch base with my clientele, with all the people that do tune in and watch me. And I'm here for anything you need, guys. Until next time, this is Dr. Pearlman.